our next speaker who would be taking this fascinating topic is Mr. Mahesh Jayaraman. Let me bring Mr. Mahesh Jayaraman on the stage. Mr. Jayaraman, how are you doing?
I'm very well, Amajit. How are you doing?
Thank you very much for asking. I'm doing absolutely excited with these sessions coming in and wonderful, insightful stuff that everyone has been sharing. Allow me to introduce you to the audience. Just a minute. So, Mr. Mahesh Jayaraman is an IAFHH certified functional hormone specialist and a co founder of Sepalika Fertility and Hormone Health Clinic. He has a profound understanding of hormone health, and Mahesh has helped numerous women manage hormonal imbalances, including PCOS and infertility. His work is rooted in functional medicine, focusing on the intricate relationship between gut and hormones. So today, Mahesh will be sharing insights into the estrobolome, that is the key player in how the gut health influences cancer prevention. So, welcome to the conference, Mr. Jayaraman.
Thank you so much, Amajit. I'll just go ahead and share my screen. Just give me one moment.
Sure, I'll check it.
Yeah, sure. You can't see my screen yet, can you?
That's correct. We cannot see your screen as yet.
Okay, all right. So let me just check why that's happening.
If you have issues, I can also share it on your behalf.
Let me just see if that's necessary. Otherwise, I'll just do one more check. There you
Sure,
go.
sure, sure.
Yeah, so I think we can see my screen now. I'll bring it full on. Can you see the screen fully now?
Perfect. That's correct.
All right. All right. Thank you so much. It was wonderful, of course, listening to Dr. Ashok. Both Dr. Ashok and Dr. Vivek are esteemed senior colleagues, and it's lovely to be bookended by them at either end. And we're all very excited to be able to speak about hormone health in general. My topic for today is the estrobolome. And like Amarjit rightly said, it's the collection of gut bacteria that's involved in the metabolism of estrogen. So how can we optimize gut health to lower hormone-driven cancer risk? That's going to be my topic. We've got limited time, so I'll dive straight into it. Okay. So the whole presentation is basically around 5 key points. You get this and you get exactly what it is that I'm trying to say. And I hope to make this useful for every single person who's attending. Premise number 1, excess estrogen leads to increased cancer risk. There is a lot of medical literature around this. So again, this is an established fact. Clearing the estrogen, once its job has been done in the human body, especially the lady's body, depends upon a well-functioning liver and gut. The liver is responsible for processing estrogen once its job has been done, but the job of removing it finally from the body is the gut, the urine as well, but primarily also the gut. Bad bacteria in the gut can recycle the estrogen that was actually meant to be removed, which means that raises cancer risk. And finally, a healthy estrobolome, that is the correct kind of bacteria that support the removal of estrogens once their job is done, reduces cancer risks. These are the 5 points I hope to bring out in my presentation. And if you remember these, you're going to have taken back some value at least from this presentation. All right. Okay. Now this complex looking graph, let me just take you through it. It isn't complex at all. This is a typical hormone cycle in women. This is what your period looks like, meaning this is what your period cycle looks like throughout the month when you're not pregnant. So we can see at the bottom over here, I hope my cursor is visible as well. You can see this red, lining. That's when your period has actually started. Day 2, the estrogen begins to rise. As your body gets ready to produce an egg, the follicle begins to mature inside your ovary. That produces estrogen that begins to rise. And that's the red line that you see moving up. It rises for about 14 days, by which time the follicle has matured and the egg is ready to be released. So estrogen is peaking around this day 14, day 15 in a typical 28-day cycle. This is just for an example. You can have different cycles, but this is how it's typically illustrated. Now, once this egg has actually been released and there is a yellow covering around, which is called the corpus luteum, that begins secreting the second hormone, progesterone. So we have progesterone as a blue line. Now progesterone begins to increase. So day 15 to day 28, progesterone rules the roost. Finally, if you don't have a pregnancy, if you choose not to fall pregnant, then estrogen rises briefly, and then both estrogen and progesterone drop, which is when again you see the second red that comes here, which means menstruation has begun. And now estrogen and progesterone are broken down by the liver because their job is done, and now they need to be excreted via the urine and the feces, right? So this is basically how the hormones are playing throughout the period cycle and why hormones actually need to be removed at the end of the cycle, right? And this is the most important organ when it comes to understanding how is it that we actually remove estrogen. It's called detox because while hormones are excellent and very important for the human body, they still are toxic once their job is done. And the primary player in this is the liver. And this is how the liver works. Phase one, estrogen, progesterone, testosterone, all of these are steroid hormones, meaning fat-soluble hormones. The first phase of detox is where the liver converts fat-soluble estrogen into partially water-soluble intermediaries so that it can be removed. Phase two is where it's fully conjugated, becomes fully water-soluble, and now it's ready for excretion. And this is where your gut comes into play. So what does the gut do? Takes the conjugated or packed up estrogen and removes it via the feces and urine. And this is where all the trouble can happen. For the sake of this presentation, our focus is if you have bad bacteria, then they're going to deconjugate or break open the estrogen that was packaged for waste removal, bring it back into the body, and that increases your cancer risk. Okay. So now, is there evidence? My first question always is, how do we know all this is true? It sounds like a nice story, but do we have evidence that the gut can actually influence the amount of estrogen in your body? And the answer is yes. This is all recent research. I'm citing here a paper from December 2019, Johns Hopkins University, and we're primarily saying there is a risk between the microbiome and the estrogen, and which in turn increases breast cancer risk, right? So all three parts are very important. And this is what the research is now telling us. And I'm just quoting a small quote from there. Gut bacteria that possess beta glucuronidase activity. Beta glucuronidase is just a long name of an enzyme. And this, when its activity is heightened, is when bad bacteria are able to use this enzyme to break open your estrogen package from the gut and put it back into your bloodstream. So there is reabsorption into the circulation that can happen if the microbiome is out of balance. Again, fancy diagram, but I really like the guys who do this. They try to simplify things very beautifully. So all you're seeing here is just the carbon structure of estrone, estradiol, etc. So all you need to know is estrogen. It goes through the liver, packaged, gets into the gut. If the gut microbiome has a problem and it produces too much beta glucuronidase, you've then got it re-entering into the lady's body, where it increases endometriosis risk, ovarian cancer risk, PCOS risk, breast cancer, endometrial cancer, and endometrial hyperplasia, thickening of the endometrial layer. All this can be caused if unbound estrogens are recirculated through the bloodstream, and various hormonal disorders can really be the result. Okay, again, recent vintage. The reason I'm highlighting here the date, it's too small for you guys to see, so I'll point it out. It's August 2021. This is basically again evidence that the gut microbiome, beta glucuronidase, is the primary enzyme that is leading to estrogen reactivation and breast cancer. And therefore, here are the key highlights. Beta glucuronidase activity, you can measure it in stool testing, number one. Number two, it's generally a reliable marker for estrogens re-entering the body due to gut dysbiosis. Number three, it's usually accompanied by relative estrogen excess symptoms. Each word has been chosen carefully, so there is relevant estrogen, relative estrogen excess, and therefore you're going to see it as PMS, bloating, breast tenderness, mood swings, hormonal acne, water retention, all things that women know and are generally asked to ignore because this is part of a period cycle. Please don't ignore it. Is one of the key messages of this presentation. So I'm going to take you through how you can look at whether or not the gut is actually playing a role in this whole process of having relative estrogen excess. So quick recap, we know phase one, fat soluble to water soluble. We know phase two, fully water soluble, both of this done by the liver. Phase three is where if you've got a gut problem, that's going to, where the estrogen is meant to be removed from the stool, that's not going to happen. So our focus is not on the liver here. I'm going to focus on the gut and how it can, you can actually diagnose the health of the gut estrobolome. So number one way of doing it, advanced stool and urine tests. Dutch is an acronym, stands for dried urine test of comprehensive hormones. So this is more of a practitioner tool for how you can tell whether the gut is causing an estrogen imbalance. More important for everybody, practitioners, patients, everybody, are there clinical symptoms that can tell us that we are at a higher risk because our estrogen is not being removed? Yes, we'll touch on that too. But a quick point, my functional medicine colleagues all know, whenever you fix anything to do with estrogen metabolism, you always go in reverse. So first fix the gut, that's number three, then fix phase two, then fix phase one of the liver. So always optimize in reverse. First, make sure the final garbage delivery removal truck is ready. Only then you start producing garbage in the house, right? So this is important so that you don't overwhelm the patient during a cleanse. All right. What is this advanced testing? Well, the primary marker we are looking for, like we said, is beta glucuronidase. I've shown you a sample screenshot of a test called GI map. This is an advanced tool testing where you can make out that this particular enzyme, beta glucuronidase, activity is far higher than you would expect in a healthy patient. Therefore, you're able to tell that there is high values can indicate that there is an unbalanced estrobolome, meaning there are too many bad bacteria producing too much beta glucuronidase that may be putting estrogen back into your system. What's the pros? Well, the patient and the practitioner both can see concrete evidence that this is the reason why we are trying to fix your gut. This is the reason why we are giving you certain herbals. However, the cons is it is expensive. It is 35 to 45,000 rupees in India. Of course, these costs are coming down as more and more functional medicine practitioners are working with these tests, but these are the pros and cons of doing an advanced stool testing. Now, can we do something that we can just do at home? Can we know for free that we actually have a barometer that tells us that there is a problem with excess estrogen? Well, yes, there is. Nature's always giving you signals. You just have to listen. Number one, if you have chronic constipation or irregular bowel movements, IBS type, any gas, bloating, cramping, especially if it's worse just before a period onset, if there are persistent vaginal yeast infections or bacterial vaginosis, so discharge, foul smelling odor, etc. per vaginum, any breast tenderness, swelling, which is especially around the PMS, the pros of this is obviously that it's visible for everybody to see, not just the practitioner, for any patient as well. However, it could also be due to phase one and phase two detox issues of the liver. So it doesn't tell us 100% that this is happening due to a problem in the gut. But here's the good news. You don't have to be 100% certain. You're worried about your overall health. You don't worry if it's coming from the gut or the liver. And there are so many beautiful free things that you can do that actually reduces your cancer risk. If you have these symptoms, don't ignore them. Know that it could be possible estrogen dominance. So what can you do? Level one, assume you have only clinical symptoms. You don't want to do the 35,000 rupee test. Well, get the basics right. Deep hydration, clean diet, right? So remove all the processed foods. You're going to eat healthy, wholesome, balanced meals at home. Sleep cycle. This is so important. I can't stress it enough. The human being is nothing but a circadian machine. I know that at some stage, Dr. Vijay Mohan Kohli, another senior colleague, is going to present on photobiomodulation or using light as medicine. So the sleep cycle, sun exposure, these are crucial. The hormone cycles in the human body are governed by the sun and the moon. So make the most, use the free, God who's sitting up in the sky and waiting to give you health. So 10 minutes of sun each day, usually best during sunrise and sunset. If you can manage it, you get beautiful UV radiation at that time that resets your hormone cycle. Second, fancy word, xenoestrogens. Xeno just means foreign or synthetic, and estrogen means that obviously the naughty guy whom we are trying to keep regulated. So cosmetics, plastic bottles, all of these contain xenoestrogens. At Sepalika Fertility, there's a free document that we share with all the patients as part of awareness. We'd be happy to share it with IAFM. And it's a PDF that tells you which are xenoestrogens, how you can reduce their impact in life. So, from cosmetics, from plastic bottles, etc. Here are foods. I mean, this is naturopathy 101 that's now been incorporated into functional medicines. Oranges, apples, cruciferous vegetables can be excellent ways to manage your estrogen load. And this beautiful supplement called calcium D-glucarate. Again, I would still say work with a practitioner, but even if you want to try it as a patient, among the safest, because it will not reduce estrogen in a very strong way or make you estrogen deficient. Calcium D-glucarate is a supplement that reduces the amount of beta-glucuronidase activity in the gut, and that's the reason why it can be quite a safe and effective option. Finally, support phase 1 and phase 2 of liver detox as well. What's to lose? You can have simple methyl cofactors from folates, eating enough green vegetables, some liver herbs, like milk thistle, dandelion, etc. DIM is the only one I'm extremely careful about, diindolyl methyl. Methane is basically a kind of supplement that is an extract from cruciferous sulforaphane rich vegetables, but it can, if you are not sure that the person is absolute estrogen deficient, if they are only relative estrogen deficient, you can end up pushing the estrogen levels too low if you use DIM early on, especially in your work that you're doing with them. Finally, of course, there are some vaginal probiotics, herbal antibiotic antiparasites. This is for my practitioner friends. If you're confident of the diagnosis and you know how to use this, then go ahead. You have to monitor die-off. When you kill bad bacteria, the patient is likely going to get nausea, is going to get loose motions, is going to get mood swings, headaches. So be careful. If you're sure about your clinical practice, if you've done it for long enough, then you can certainly use herbal antiparasites as well. Oral pre and probiotics, again, excellent things, starting with a simple dahi and going on to a lot more. Okay, now, if you have confirmation with the GI map, you've got 35,000 rupees to spend, you want to know, you're absolutely sure that this is the certainty you need, even then, what would I do? And this is, I'm showing this for everybody to know that it's not like the test is 100% necessary. We only use it in the most tough cases. We don't use it every time. This whole box, this transparent box, is exactly identical to what you do without a test. All of this you can do anyway, right? So do all of these. The only thing that I would do differently if I had the GI map or the GI 360 is it gives me a breakup of the particular kinds of bad bacteria and good bacteria. That tells me what kinds of herbals I can use to address that particular dysbiosis. So in my opinion, that's really the only reason to use this kind of testing. Very advanced cases, IBS-led hormonal imbalances, we use them. All right. So I think I have about 9 minutes left. So I'm going to quickly show you one clinical case so that I can illustrate what it is that I mean, that you can reduce your cancer risk truly by just addressing the estrobolome. Okay. This was a referral from a doctor in the US. The lady had discovered that she had a 1.8 centimeter lesion on her right breast. And there's a particular rating which is BIRADS 4A. BIRADS 4A is highly suspicious, which means that if it progresses any worse, they're going to ask for a biopsy because they're worried that it's almost precancerous. Okay. 6 months prior to the discovery, she had had fatigue, disturbed sleep, bloating, etc. All things many women are usually familiar with. Periods were still regular, 25 days, but they were heavy. PMS symptoms were all there, migraines, mood swings, etc. SOS Tylenol use, it's similar to our Dolo here. So, you use a painkiller, try to mask the symptoms. This is how she was managing it. And she had already had a laparoscopic removal of a fibroid and a endometrial polyp 3 years back. So that again gives you a hint. Estrogen is likely high. Lots of these are estrogen, at least relative excess symptoms, right? And again, obstetric history, not very important, but again, shows that she had a difficult pregnancy and preterm delivery. Again, there is a hormonal imbalance that she had. Okay. What was the diagnosis by the referring physician? He again, was a functional medicine doctor. So not just a referral from a conventional allopath. So there was estrogen dominance. They had already identified that she had a carb heavy diet. Inflammation markers were high. She had D3, B12 suboptimal. All of this has been addressed by the doctor who finally referred. So she was on an LCHF diet. She was gluten dairy free elimination, functional optimization of D3 iron, etc., had already been achieved. Anti-inflammatories like curcumin, quercetin were being used. What happened? Well, she felt better. Of course, she'd feel better because all of this is the functional Bible. They're working on at least the branches, if not the root at this point. So she felt better for 2, 3 months, but then the symptoms came back. And the patient had a history, family history of an aunt with breast cancer. So she was very, very worried, right? So when such patients come, and again, I picked this case because I can illustrate the whole spectrum of everything we did. She was very keen. So we did the Dutch test and we did the GI 360. She was in the US, remember, where all of this is accessible to her. What did the Dutch test show? Well, the dried urine test of comprehensive hormone showed that she was likely not ovulating well. So progesterone levels were low. This is another thing, again, more for my practitioner friends than for lay patients. We know that estrogen, when it's broken down into the liver, can go down one of three pathways. There's a 16-OH metabolite pathway, there's a 4-OH pathway, and a 2-OH pathway. The 2-hydroxy pathway is the safer one. People with more 2-hydroxy activity have lesser cancer risk. Those with 4-hydroxy have the highest cancer risk. And sometimes the 16-OH, which is proliferative estrogen, can also be risky. This, when we saw it in her Dutch testing, hers was going more into 16 and 4 more than the 2-OH. However, she was methylating really well. So that second phase of liver detox was happening well. So estrogen was being cleared from the liver. It was at least reaching the gut. But when we got to the gut with a GI 360, it showed that beta glucuronidase activity, the enzyme that we spoke about, was really high. And she had a high load of enteropathogenic and enterotoxic E. coli, so Escherichia coli, and she was low on beneficial lactobacilli. Now, this is what you get in a breakup in a GI 360. So it can tell you what are the specific strains that you have to address. So what did we do? Again, we did not do any fancy herbals to begin with. Start with cleaning up. What were the gaps in whatever the referring doctor may have left for us to do? Number one, clean up her cosmetics. Most women don't realize lipsticks, eyeliners, chapsticks, foundation all have xenoestrogens that are going to go into the skin directly. They don't go through the liver, they enter the blood directly, and they're going to cause estrogen excess relative, right? And we noticed that when we asked for the ingredient side of her lipstick, there were some mineral oils that were suspect for PCBs, which is one of the xenoestrogen categories, which increase actually 4-OH activity. And here's again, simple, right? Start with food as medicine. Here's a grapefruit. She had access to lovely grapefruit where she was. So we gave her a grapefruit every day. It inhibits estrogen moving down those two naughty pathways of metabolism, 4-OH, 16-OH. It limits it. And finally, ours is an integrated practice. So we used B. coli 30, which is a homeopathic medicine that can disrupt E. coli. Other colleagues of mine use other biofilm disruptors and use various things. We use essential oils, peppermint oil, again taken away from homeopathic medicine, helped her with her symptoms. Adding leeks and garlic at least thrice a week to her diet provided her with the prebiotics. And finally, we asked her to make she was South Indian descent, so she knew what a paranganji was, basically boiled rice that is left overnight with water on top of it, and it produces a lovely probiotic blend that you can use. Comes with its own prebiotics. So we did all of that. Calcium glucarate, like I said, was added. And sunlight exposure at sunrise and sunset, and structured mineralized water. I know one of the sponsors is Analema. I had the good fortune to speak with one of the founders a few days back, and the power of water really was brought back to me again. So establish sunlight, water, circadian rhythm, and we used iodine locally on the breast tissue. This is often very important for all growths. Breast tissue is very sensitive to iodine deficiency. So if you apply a Lugol solution, you will begin to break up any calcifications and begin to work that. All right, I'm going to quickly get to how things began. I have only 2.5 minutes left. Began to feel better from the first month, less breast tenderness, bloating, all the PMS symptoms improved. Again, we have objective measures. How many Tylenols did you have to take? We measure the number and actually it came down. Circadian biology responded. She was tracking her sleep using an aura ring. Nowadays, you have other Indian beautiful variants as well. You can use any of those to see if you're sleeping better. And in 4 months, the lesion shrunk from 1.8 to 0.6 centimeters. And from the radiology that they did, it was downgraded from a highly suspicious abnormality at BIRADS 4 to a BIRADS 2, which is definitely benign, right? All we have done is we have stopped adding estrogen fire fuel to the fire. There was a fire that was ongoing, there was proliferation, wrong growth happening, and we have just helped the body to remove the estrogens, right? So quick takeaways, and then maybe I'll have a minute left for questions. I'll try to finish this very rapidly. What should you not do if you don't want to test? You just want to work with symptoms. This is what you start. Number one, don't ignore repeated symptoms. We do awareness talks in schools, and many girls are so hesitant to even tell us that they have PMS. But remember, early PMS and long lasting over years can increase your cancer risk. So don't ignore these symptoms. Try a few things yourself, then speak to a practitioner. Second, again, we'll share that xenoestrogen document. All of these lipsticks and oil that's often sold in plastic bottles in India is deadly. We have heat exposures, you have parabens, you have all kinds of chemicals leaking into the fat medium, and that will increase your estrogen load in the body. Finally, and my soapbox rant again, I hope I set it up for Dr. Vijay Kohli to slam dunk it at the end. Use night mode on all your blue block, block your devices after 6:30 p.m. wherever you are. Make sure you have blue light blocking software on your devices. Use, like this lady's got this very fashionable amber glasses. Put those on after 6:30. Your body will thank you. Your hormones will go back into balance. What can you do still? Again, fix your hydration. All of this we know. Foods that lower, beta glucuronidase, apples, grapefruit, etc. Support phase one, phase two. Just, start with, again, I'll just spend 10 seconds. 1 cup of coriander curry leaves daily. 1 tender coconut water. This is something that we use for methyl cofactors for everybody. And we get wonderful results. All our pregnant ladies take this, they go the full term. Dr. Vivek Kadambi, and we have the good fortune to co-manage so many cases with him, and he knows our ladies who have fertility issues go to a full 40 weeks of pregnancy, 3 kilo babies. All this happens with methyl cofactors. So hormones love methyl cofactors, and the simplest, cheapest, zero pesa, just pay the vegetable guy. Coriander, curry leaves, 1 tender coconut water. There are some exceptions. Again, be careful, don't overdo it. If you have kidney stones or sodium potassium imbalances, you want to be careful. Finally, probiotic curds. This picture is courtesy my co-founder Sharda Agarwal. This is her probiotic curd batch. You can do this at home. You can have wonderful support in your gut, right? So I hope that I know this was TMI packed in too fast, but I hope it was somewhat useful. Happy to take any questions if I know I fully run out of time.
No, you did. I extended it. That's why I didn't come. I think
Thank you
you
so much.
need to really look into the so many hearts and thumbs ups coming in. Sorry, just a minute. I think I clicked on the wrong button. I'm sorry, everyone. Please let me put Mr. Jayaraman back on stage. I'm sorry. Sorry for the glitches. It happens. Anyway, I'm just gonna stop the sharing. All right. Absolutely fantastic session. I think the reactions already tell that uh, right in front, and obviously I'm going to get a little sorry for the gender bias, but as a female, it's really nice and it's really really wonderful to see that the males can describe what's going on in periods, and of course what's happening in the follicular phase, the luteal phase, and which we label as, okay, well, something's happening with the anger, the hanger, and the mood swings, etc. So with I'm just talking very laymanish right now, but that's true. That's true. And when you come down to the estrobolome, and when with the lady, the case that you came up with, undoubtedly there are so many women like out there who are facing this issue, and it just sometimes baseline stuff doesn't work, and you really need to dig deep to find out what's going on. So an excellent presentation over there. I'm going to quickly look into the question and answers. So there was one question, which is with figures, I believe. It says, what if the beta glucuronidase in GI map is 533, which is well within the range, but strong relative symptoms are still there, like breast tenderness, and the E2 is still low, maybe high in relation to progesterone. For example, E2 is 28 on day 2, and progesterone is 5 on day 15 of cycle. If
Excellent. Very, very strong, very technical question. I'll try to make the answer really short, right? So, what we have to remember is absolute numbers on a lab test doesn't work for everybody. Like Dr. Kadambi, Ashok Kadambi was saying, you can suppress PSA down so much that the person dies of a heart attack, right? So, as far as we are concerned, we don't treat numbers. So, even an E2 that's in the 20s, even a P4 that's at 5 on day 14 or 15 in the luteal, I mean, day 21 on the luteal phase, we would still say that the person is likely extra sensitive to estrogens. So here is where you can really use things like flax seeds, cruciferous vegetables, which are phytoestrogens, weak estrogens that can help to occupy receptors, for example, in the breast tissue. See, why does breast tenderness happen? Most of the time it happens because the liver is unable to process whatever estrogen it has. Your liver may process more estrogen, somebody else's is not that efficient. And the body needs a parking space where estrogen can be stored. So it takes it to estrogen sensitive tissues. What are they? Breast tissue, thighs, upper back. That's
uh,
the reason women face these pains in these areas, because the liver is saying, I have too much backload, go and park it somewhere in a parking bay, bring it back after I'm done. So the answer here is again, support the liver. Use the simple milk thistle, use things that can support liver health, beetroots, cruciferous vegetables, and you will begin to notice a change in the clinical symptoms. Labs are good, but let labs only reiterate what's happening with the patient. Treat the patient in front of you. Don't go with numbers, right? That's a median, it's a mean. It's not really clinical medicine.
so brilliantly concluded over there. I'll just take one more question, which says, which microbiota causes the breaking up of the estrogen package? Can it be detected in stool microbiome testing?
Yes, that's exactly what the GI map and the GI 360 do. There are multiple families of bad bacteria that lead to increased beta glucuronidase activity. So E. coli, for example, was one of those that I said. Bacteroides are another. There are multiple, ones, and you can use herbals which can be specific to certain families of bad bacteria, and that's how you can use that information.
Okay, and I'm going to take two more questions. Is Vitex ashwagandha shatavari helpful in case of relative estrogen dominance, where progesterone is too low, around 3 in the luteal phase?
Yes, it can be, but those three are three separate animals, right? So Vitex acnes castus is a while it improves progesterone secretion, it can increase LH. So be careful if you're a PCOS patient and if you take Vitex, especially in the second half, you will get a better progesterone secretion, but you will also get an LH increase. And women with PCOS already have a luteinizing hormone dominance. That's why home ovulation strips don't work for them. So be careful if you have PCOS with Vitex. Again, these herbs are very strong. They may be sold as OTC supplements, but if you don't know what you're doing, you're going to run into trouble with these. Ashwagandha, Shatavari, far safer profile than Vitex, right? Vitex is a very, very sort of, it does many things, but it does one very powerful thing, which is the LH issue. With Ashwagandha and Shatavari, you should certainly see better over. See, again, I tell people, give yourself 3 to 6 months. Herbs are not allopathic medications. They are not being one isolated molecule. They take time to work. So give it a little bit more time and you will see the results of Ashoka and Shatavari. Both are healthy, decently safe herbs that you can use.
And finally, I'm just going to take one more question, which is a general question. What is the advice for women who are entering menopause?
Oh. It's a very big one, but I would certainly say again, be careful. See, the most important change that happens in menopause is women start putting on weight. The reason, and I'm not bringing this as a vanity point, the reason you're putting on weight is because your body is trying to secrete estrogen from fat cells. It's trying to make estrone in place of estradiol that you make on a monthly basis while you're cycling, right? So while you're working towards that whole, oh my God, why have I put on why have I put on this weight, and I'm going to hit the gym and I'm going to do X, Y, and Z. That may not be the actual way to get there. If you again keep your sunlight exposure going, if you work on a few of these, too much makeup, again, your vanity takes over at that time. You want to hide all the crow's feet, you start using even more cosmetics. Be careful of the kinds of cosmetics that you use. We'll be happy to share that document. Just do what your mother, grandmother did. You're getting to menopause these days much more tired than your mother or your grandmother did.
Mhm.
Now the adrenals are more tired and they can't take over all the work of the ovaries. Be kind to yourself. Most important, right? Form a girls club at that age, right? So make sure that you exchange little tips with each other. Hydrate well, get sunlight. You should get there much better.
Well, I got really scared with those xenoestrogens. So I'm going to thank Zoom as well, who is all who's the base of this and giving me filters. So I don't have to wear lipsticks and all that. So great. Thank you so much, Mr. Jaraman. It was definitely an enlightening and enriching presentation.